Welcome to Pet Vibes, the channel where we help pet owners recognize dangerous symptoms early and take action before small signs turn into life-threatening emergencies. Seeing blood come out of your pet's nose when they sneeze is terrifying. It's not something most owners expect, and it's never something that should be ignored. While an occasional sneeze can be harmless, blood-tinged sneezing is a warning sign that something serious may be happening inside the nasal passages or sinuses. The cause can range from infection to trauma, but in many cases, fast action is the difference between recovery and permanent damage. Blood in a pet's sneeze usually means that the delicate blood vessels inside the nose have been damaged or inflamed. The nasal cavity is extremely sensitive, and even mild irritation can cause bleeding. However, when sneezing becomes frequent or the blood appears more than once, it often points to an underlying disease that needs veterinary attention. One of the most common causes is a sinus or nasal infection. Bacterial, fungal, or viral infections can inflame the lining of the nose and sinuses, causing swelling, pain, and bleeding. Fungal infections, especially in dogs, are particularly aggressive and can destroy tissue inside the nose if not treated early. These infections often come with bad odor from the nose, discharge, facial swelling, or behavioral changes. Another serious cause is a foreign object lodged in the nasal passage. Grass seeds, small sticks, dirt, or insects can get trapped when pets sniff the ground. This can cause sudden violent sneezing, pawing at the face, and bleeding. If the object stays inside, it can lead to infection and ongoing damage. Nasal tumors are another frightening possibility, especially in older pets. Tumors inside the nasal cavity can cause chronic sneezing, one-sided bleeding, facial deformity, and breathing difficulty. These signs often start mildly and worsen over time, which is why many owners delay seeking help until the disease is advanced. Trauma is also a common cause. A fall, rough play, being hit by a car, or even a fight with another animal can damage the nasal structures. Sometimes the injury isn't obvious from the outside, but internal bleeding shows up through sneezing blood. In some cases, blood clotting disorders or poisoning can cause nosebleeds and bloody sneezing. Certain toxins, including rodenticides, interfere with the blood's ability to clot, leading to bleeding from the nose and other areas. This is an absolute emergency and requires immediate veterinary care. Symptoms that should never be ignored include repeated bloody sneezing, thick or foul-smelling nasal discharge, facial swelling, difficulty breathing, lethargy, loss of appetite, or behavior changes. These signs indicate that the problem is not minor and is likely worsening. Diagnosis often requires a thorough veterinary exam, imaging such as X-rays or CT scans, and sometimes nasal endoscopy or lab tests. Treatment depends entirely on the cause and may include antibiotics, antifungal medication, surgery, or emergency supportive care. The most important thing to remember is this: blood coming from your pet's nose is never normal. Waiting to see if it stops on its own can allow the disease to progress quickly and reduce treatment options. If you ever notice your pet sneezing blood, keep them calm, prevent them from pawing at their nose, and seek veterinary care immediately. Acting quickly can save your pet's life and prevent long-term damage. Thank you for watching Pet Vibes. Our goal is to help you recognize dangerous signs early and protect the pets who depend on you. If this video helped you, subscribe for more life-saving pet health information, and we'll see you in the next video.